and welcome to SureenaSpeaks, and in this video I'm going to be providing advice to those of you who will soon become provisionally registered pharmacists. Now, across my socials I did put out if anyone had any particular advice or guidance or questions that they wanted me to cover in this video. I did get an overwhelming response, so I've tried to group some of those questions together as some were quite similar, and I hope to cover your question in this video. If there are any questions that you have after this video, then as always, please do feel free to get in touch through any of my socials or by writing a comment in the description box below. Now, I have made notes and I've written out what your questions were and made notes which I've got in front of me. Usually I don't like looking at notes and paper when I'm making a video, just prefer not to, but this time around I think it's so important that I get the advice right for you, and some parts I'm taking extracts that are available on the GPHC website, so I want to make sure that I am giving you the absolute correct advice. So I will be referring to these notes that are in front of me, so do just bear with me when I'm going through some of those questions with you. So first and foremost, general day one advice, and especially advice for those of you that will be working as a responsible pharmacist. So before you start, make sure that, this is regardless if you're going to be a responsible pharmacist or not, make sure that your employer has filled out a risk assessment form. GPHC produced guidelines and guidance for employers, and I will include that link. It's in the public domain. I'll include that link in the description box below as well. Yes, it's for employers, but I think it's really important that you have a read of this as well. As part of that guidance, it states that anyone who's going to be a provisionally registered pharmacist, or PRP as I'm going to refer it to, just because it's provisionally registered pharmacist is a lot of syllables, and it's quite long to keep saying, so PRP. Anyone who's a PRP has to have this risk assessment form filled out, and so if you're thinking, what on earth is she talking about? I have no idea about this, then do ask your employer, do ask your senior pharmacist if they have filled this out already, or when they are planning to, and you're well within your right to ask that question, so do check that out. Next piece of advice that I have is eat breakfast. Make sure on the day that you are acting as a day one PRP, eat breakfast. Now, that might seem like a really bizarre thing to say, but as they say, breakfast is the most important meal of the day, and you really need to look after yourself. Genuinely, you know, when you're acting as a pharmacist, when you're acting as a pre-reg, there are differences, and I can only go by my own experiences, but even as a pre-reg, even if I had a really short lunch break, I always, well, my tutor always ensured that my lunch break was within certain hours. So it was great. I knew when my lunch was, it was all timetabled out. Pharmacists don't always get that luxury. Now, during COVID, there have been a lot more stores that are having that dedicated and protective 1 hour for a pharmacist lunch break, which rightly so, but not everyone does get that. And so sometimes you might, I mean, I've had it so that I've started a shift at 8:30, but I don't actually have my lunch until 3 p.m. So you don't know when it is that you'll next get to have that lunch, and it's a sad truth, to be honest. So make sure you have your breakfast, make sure you're feeling fueled and energized for the day, because it really does make a difference. You might also find it helpful to have like a little notebook or diary with you, just to jot things down as you're going along. We're always learning, and it's not always professional to get your phone out and write notes on there. So do have a notebook to hand, take pens, take spare pens, and don't take a pen that you have emotional investment in. I know of pharmacists who have been gifted Parker pens or, you know, fancy pens for starting off as their day one, and that poor pharmacist will lose that pen, because that's just what happens in pharmacy. So don't take a pen that you're gonna end up being really sad about that you've lost, but do take a pen and a backup pen with you, because you can never be too safe. Next advice I had for you is show up early. I don't mean on time, I mean early. If your shift starts at 9, don't be turning up there at 8:59. Get there in plenty of time. Hopefully you'll be working in an environment where, if it is, for example, a community pharmacy, that there is somebody there who will be opening the pharmacy a bit earlier so that they can get their bits and pieces done before it's open to the public. This is a real opportunity for you to become familiar with your surroundings, even if it's a pharmacy which you've been working your pre-reg in, or it's a pharmacy which you are familiar with. It just eases you into that day. It just prevents any stress of rushing because you might be running late or anything like that. So do get there in plenty of time. If you're working in a place which is unfamiliar to you and maybe they operate a different system than you've been using in your pre-reg year, for example, maybe they use next phase, but you've had experience in pharmacy manager, this is a prime time, this protected morning, to get to grips and get grasping with how to use those different systems. I mean, even better would be actually being familiar with all of that before you start your day one. But if you don't get that option, then at least on your day one, try and get familiar with those different processes and procedures that that particular pharmacy might have in place. Getting there early also ensures that you are making a good first impression, and it will make you familiar with who is in your team. It's really important that you do work well with your team. You'll be with them more than you'll probably be with anybody else, especially if you're working full time. So having those good relationships, those good rapport with the team, and ensuring that you do so at the very beginning is really, really important. So show up early, not on time, but early. So now, if you are going to be practicing as the responsible pharmacist, your notice that you have displayed must state and must identify that you are provisionally registered. This is written within GPHC guidance. It's written in that employer document that I had mentioned earlier as well. So stress it out again. If you are the RP, you do need to make sure that your RP notice states on there somewhere that you are provisionally registered. It provides openness and honesty and provides clarity to patients. So make sure you do have that on there. So my next piece of advice is have confidence. Now, that's a lot easier said than done. I do appreciate that. And when I've spoken to other qualified pharmacists who've been through day one, I can't explain it to you, and you probably won't get this until you've actually gone through your day one, but it's almost like your brain something just clicks, and suddenly you go from being in pre-reg mode to being in pharmacist mode. And your mindset just completely changes. And I know other people who have felt the exact same as that as well. And I mean, don't get me wrong, I was bricking it on my day one, as most people are. It is scary, but you know, self-confidence and self-belief do go a very, very long way. And there are so many different techniques out there to try and help boost your confidence. For example, standing in front of a mirror and reciting certain phrases, such as "I believe in myself." You know, some people might think, oh, that's really corny or that's really cheesy, and feel like an idiot for doing it. But hey, what are you going to lose by trying it, especially if you are feeling underconfident? It's worth giving it a go. It's worth Googling those different techniques and seeing what works for you to try and boost that confidence. Knowledge is power as well, and the more up to date you are with your knowledge, the more confident you will feel as well. Of course, there will always be new updates, and of course, there will always be new guidance, but as up to date as you can be with your knowledge will help with your confidence so much as well. And actually, it's about being really honest with yourself. If you're sitting there thinking, you know what, I'm going to be starting in next week or in a couple of weeks, whenever it may be, I really, really don't feel confident with being a PRP, then I think you actually need to be really honest with yourself as to whether or not you should continue to be a PRP or progress to being a PRP. And there is no shame in saying, actually, you know what, I don't feel ready for this. It's always down to patient safety. It's down to your safety as well. So do what feels comfortable for you. Don't feel pressurized by anyone. Don't just think, oh, because all my friends are going to be PRP, so I need to do the same as well. If you don't feel ready to do that, then have those honest conversations with yourself, but also with your tutor, with your senior pharmacist, with your employer. Do have those conversations, and it might be that actually next month or in a couple months, then you will feel confident being a PRP. But if you don't right now, do be honest with yourself. I think that's so, so important. Next advice, don't be a snob. Be all-rounded. I mean, advice is that thing where someone can give it, it is completely down to you what you want to do to it. It's completely down to you how you want to take it. There will be pharmacists, and I'm sure you've probably come across pharmacists who literally just come in, do the absolute bare minimum, will maybe do a couple of services, will just stand at the back and check, and will do nothing else. And just think how unproductive you think that person can be to a team. Think about how they're not integrating with the rest of the team. Think about, are they actually being a team player or not? And then think about, do I want to emulate that, or do I want to be an all-rounder? Don't think that you're above anybody or you're beneath anybody. The relationship of being a pre-reg to being a pharmacist, it's quite a step, because suddenly when you're a pre-reg, at least when you're starting at pre-reg, you're kind of the bottom of the food chain, and suddenly within like a day you rise to the top of that food chain. It's a really bizarre feeling, and I think when you're working in a pharmacy where you've done your pre-reg store there, so you've been working with your dispensers, with your pharmacy technicians, whoever it may be, can sometimes be a bit of a power shift and a power struggle, and it can make it a little bit awkward, because it might be previously that your pharmacy technician was the one that was delegating out tasks to you. Now suddenly you're the one delegating out tasks to them. So it is a very delicate relationship, and you need to make sure that you are sensitive and mindful of that. But don't be a snob. You can take out the bins, you can count scripts, and it's all about showing that good impression, and your team will value you so much more, and you will be valuable to the team if you are flexible, if you are helping out, if you are being proactive. Equally, don't be a mug and do everything so that everyone else is chilling and doing nothing. But let's face it, that never happens in pharmacy. But it is about having that balance. So making sure that you are being of value to your team, that you are being a team player, and that collectively you are helping each other out. Next advice, stay calm. Just take a deep breath for a minute. Just breathe in and breathe out. Just stay calm. And you might tell yourself that several times whilst you're working. Just breathe in and breathe out. Just take a moment. Pharmacy is not a race. Checking prescriptions is not a race. It doesn't matter if you have a patient screaming and shouting because they have waited a whole 5 minutes for their prescription to be checked. Especially if you're the RP, it's going to be your name on that wall, okay? Don't do anything to jeopardize that. Patient safety always comes first. Your safety and your team safety also is massively, massively instrumental and massively important. Stay calm. Do whatever feels right for you, whatever feels justified. Make sure you can, whatever decision it is that you can make sure you can back it and you can justify it. Make sure that you write notes in the patient's PMR of conversations that you've had with them. Anything that you think is of relevance, do make those notes in their PMR. I don't just mean, you know, want to scrap a paper which could go in the bin. In their PMR, make sure that you do have those notes. And, you know, especially when it comes to checking, I know I've been in that position so many times where it feels so pressurized because you have these people who are, well, being really quite aggressive and demanding that you can do things within a snap. Oh, you're just sticking a label on a box. How long does that take? And the number of conversations I've had with patients in the past where I've given them a detailed breakdown of what actually happens when they hand over that prescription to the pharmacy team to try and educate them that actually it's a heck of a lot more than sticking a label on a box. You know, it is patient safety at the end of the day, and and just don't rush. It's also about managing people's expectations as well. So when you have that person saying, oh, it's been a whole 5 minutes, why isn't my prescription ready? Have that conversation with them. Actually, this and that happens when you bring in your prescription. It will take time. I've actually got a few other people's prescriptions ahead of yours that need sorting out. You know, trying to explain sometimes is of benefit, sometimes it goes in one patient's ear and out the other, but I always think if there's an opportunity to educate patients, then do so, but do stay calm, do feel what's right for you. It's not a race. I have had some people ask me, what should I actually do with the prescription? Because I know what to do with it as a pre-reg, but what do I do with it as a pharmacist? And I don't think you're giving yourself as much credit as what you already know. Let's strip it back to basics, okay? Patient hands in a prescription. What happens with it? It needs to be legally checked. So check the date, check the age of the patient, check their name, their address on there, check has it been signed, look at what medication has been prescribed. Is the formulation written? Is the quantity written? Once you are satisfied that it is legal, and bear in mind if it's a controlled drug, there's a whole array of other legality checks that you will need to do, then check, is this clinically appropriate? Now check what processes you have in place when it comes to dispensing, especially if it's a place where it's going to be new to you and you've not worked there before. I've worked somewhere where they did have robust systems in place for dispensing, but even if you have a robust system in place, sometimes the staff members or the team, they don't always follow those procedures thoroughly. So I know of one situation where there was a prescription for Dactarin oral gel for an elderly gentleman, and it went through the dispenser or pharmacy technician, I'm not too sure, but it went through the necessary process. And with this particular pharmacy, they were meant to attach little information notes with every prescription. So if any warning messages came up when they were dispensing or generating the prescription, any of those warning messages that popped up, they were meant to be noted on this little information sheet. They also had these little laminated cards to notify that whoever was doing the final accuracy check that this patient is on lithium or they're on any high risk medication. And this was then meant to be given to the pharmacist to then clinically check it and accuracy check the medication. And on this little information sheet, nothing was written on there to suggest there were no warning labels or anything like that. So everything was good to go, everything was fine, got dispensed to the patient on their way. That was the end of it really, or at least that's what the team thought. Turned out that patient was on warfarin, and they had warfarin dispensed from that pharmacy before, and a warning label must have popped up, but somewhere within the process when that prescription was being generated, it wasn't noted. That led to that patient then going into hospital. Luckily, everything was fine, patient was okay, and actually the patient didn't blame the pharmacy at all. They were really kind to the team and, said it was one of those things. And I mean, that's very, very, very rare to happen with an incident like this. And obviously the team then had to reflect and look back, look at their processes, make sure that the team was fully trained, etc., etc. Moral of the story is, make sure that you do know what that patient is on, that team is following those processes that are in place and they are following them properly. I'm not telling you this story to scare you. I'm just telling you to make you aware so that you too don't end up in a position like that. Check for yourself, is that patient on any high risk medication? Ask them before the medication is handed out even. Get to know your patients, get to know your surroundings, and like I said, I'm not telling you the story to freak you out or anything like that. I'm sure your own tutors have plenty of stories that they know of things that have happened and near misses and etc. This is just more to make you aware that your teams are following systems properly, there are good systems in place, and that you are aware of what those systems are too. Another piece of advice is ask for help. That's why you have your senior pharmacist. Don't feel ashamed to ask for help. I hate that notion that, oh, you're asking a silly question. I made a whole video about why questions aren't silly. There is no silly question. You'd rather be safe than sorry. So do ask. Ask your team, or your pharmacy technicians, your dispensers, again, whoever it is that you're working with. If you're working in a GP practice, ask the staff that are around you, your doctors, etc., your nurses. Do you feel confident with being able to ask those questions? And what I'd also say is, maybe jot down what that question was that you asked and what the answer was for that particular question, because you don't want to come across that you're asking the same question again and again and you're not really taking in what that answer is. It's okay to not know something and not understand something, but you need to be proactive with your learning as well and take initiative too. So if you don't know a question, write down what that question was that you asked, write down what that answer is, and at least if you're in a similar situation or you've just forgotten what the answer was, you have it written down there, and you can refer to your notes. But do ask for help. Please do continue with your revision. Even with, at this point, we still don't have an exam date, we don't know when the exam really will be, not too sure what the format will be. GPHC have said that it's most likely to be online, and I know there's been a lot of questions around what will that actually look like, how will that actually work. There is no answer to that right now because GPHC are exploring all their different options. So that doesn't mean though that because they're doing that work and because we don't have a date, that means that you could stop your revision. As you're working as a pharmacist, you will probably find there were things that you will naturally come across that maybe you weren't aware of before, or maybe you weren't too sure of before. You're not just learning to pass an exam. You're never just learning to pass an exam. You are learning to be the most confident and competent pharmacist that you can be. So don't stop with your revision. And I know a lot of people have said that, how am I going to revise and work at the same time? Like, how is that even possible? Thing is, you got through COVID, especially those of you who worked during COVID. You managed to handle and take on all of that responsibility and stress and pressure and get through it. Plus, before COVID had even come about, you were probably working and revising at the same time as it was. So you've done that, you've been there. Don't let that be an excuse that you then use to then demotivate yourself from continuing with that revision. Do keep your knowledge up to date. I know I've said it a lot in this video already, but it does always go back to patient safety. Patient safety goes back to your safety, team safety. So continue with your revision. Don't let that stop. Don't just get compliant and think, oh, I don't need to revise anymore. You do. Keep revising. My next advice is to connect. Make sure that you do connect with other healthcare professionals, with other pharmacists, with other provisionally registered pharmacists, with pre-reg students. LinkedIn, I've said it in previous videos before, LinkedIn is such a great resource to use. It's such a great way to network and connect with so many people, not just pharmacists, but loads of people within industry, within other healthcare professionals, probably even companies you've never heard of before. It's just a good way to have those links, have those interactions with people and connect with them. Through social media as well, Twitter, Instagram, do connect through people, and don't forget your pre-reg friends that you've made along the way, especially if all of you are going to be PRPs. No one can relate to you better than you can relate to each other. Swap stories, share information, ask each other, how did your day go? What did you learn today? What was troublesome that had happened in your day? You can learn through each other's experiences, and it's just so important to have that network around you and people that you can go to and turn to for sometimes just a little pick-me-up, sometimes for some advice, some guidance. So don't stop making those connections. A lot of people might think, what's the point of me getting LinkedIn? I really don't see a point of it. Genuinely, it is worth it. It doesn't take long to set up a profile. I mean, I feel like I should get sponsored by LinkedIn for the amount that I promote LinkedIn, but it really is a valuable and useful platform to reach out and connect to all different types of people within any sector, really, recruiters as well. So do remember to reach out, do connect with other people, and form your own network of peers who you can turn to for support. So now I'm going to go through some specific questions that came through, and this is the point where I'm going to start looking at my notes because I want to make sure that I get the answers right for you. So one question that came through was, how should we be addressed? Provisional pharmacists or pharmacists? I mean, there's no real hard or fast rule. GPHC haven't said that you must be called this, not called this. What really matters though is if you are the responsible pharmacist, then on your RP notice, it does state that you are a provisionally registered pharmacist. So that needs to be clearly identified on there. Next question was, how does indemnity cover work? Am I covered by my employer? This question, a lot of people asked it, and honestly, it really depends on where you work, so you need to ask your employer. Some companies or some employers, you will be covered by their professional indemnity policy. Some of them, you won't be. So it's not a one rule for all type situations. Some of them you will be covered by the policy, some of them you won't be. So ask your employer, are you covered by their indemnity insurance? If yes, happy days, don't need to do anything further. If not, you need to seek for indemnity cover. I had a question that came in saying, what happens if a dispensing error occurs while a PRP is on duty? Great question. It's the same as if you were a pre-reg and you made an error, or if you were a pharmacist, a fully qualified pharmacist, and you made an error. Your place of work will have their own policies in place about what happens with near misses, what happens with errors, and the procedures and protocols that follow that. Probably will be an SOP in place as well, which you'll need to have read and signed and be familiar with as well. But yeah, it's the same thing, like I said, if you were a pre-reg or fully qualified pharmacist. Another question, what to do when you're stuck? That's what your senior pharmacist is there for. They are there to guide you, they're there to help you, they're there to answer your questions. Going back to what I was saying about making those connections with, or keeping those connections with your pre-reg friends as well, ask them, if you have a WhatsApp group, for example, ask them a question on there, help each other out, support each other. Your pre-reg tutor, if you had a good relationship with them and you got on well with them, I'm sure you can turn to them for advice as well. That's why networking is so important, so that you do surround yourself with people that you can support, who can support you and that you can turn to for advice and guidance. But primarily, that's what your senior pharmacist is there for. So again, don't feel scared or worried to ask them any question. That's what they're there for. Also use resources, so BNF, the SPS website, EMC website, NICE guidelines. There's so many resources at your fingertips. Ask your colleagues too, your pharmacy technicians, dispensers, accuracy checking technicians, whoever it is that you're surrounded with. Utilize your colleagues as well. Be proactive, take initiative. These aren't just words to throw around. Try and utilize the resources that you do have around you. So next question was, what certifications and trainings should we have? Now with this one, I did go back and forth with GPHC slightly. So again, I'm going to be reading word for word what I have written down here, just so I get it right. So as I mentioned before, employers must complete a risk assessment form before a PRP starts work. In the employing a PRP guidance document written by the GPHC, again the one that I mentioned earlier, and we'll include the link to in the description box below, it says that it needs to be assessed whether the PRP is suitably trained to carry out a range of services. So I'm guessing, for example, flu vaccination training, MUR training, EHC, safeguarding, essentially any services that you are interested in doing, inform your employer so that they can note it on the risk assessment form so that it is included as part of the individual risk assessment. That is the answer that I got from the GPHC. So you can carry out these trainings, but it does need to be noted on the risk assessment form. It does need to be part of the risk assessment form as part of the individual risk assessment. So do speak to your employer. Another question was, how can I find a job as a PRP? Again, my good friend LinkedIn comes involved in this one. So I put out a post a while ago asking for those on LinkedIn, employers, recruiters, to drop a comment if they did have any vacancies or they could help any PRPs with securing a job role. Did get a response from a few employers, a few recruiters. I'll include the link to my LinkedIn and to that particular post again in the description box. So if you're still struggling to find a role and you don't have one at the moment, then do get in touch with those employers and those recruiters, and hopefully they will be able to help you out. So the next question is, how can I be comfortable outside my comfort zone, i.e. not being a pre-reg anymore? So I quite like this question because it says to me that this particular person must have had a lovely pre-reg year, presumably a lovely team as well. And it can be scary to be outside of your comfort zone, and change can sometimes be a scary thing as well. But think of it this way. When you first started your pre-reg, you probably felt at that point you were outside of your comfort zone because maybe you're coming straight out of uni and you went straight into your pre-reg year and uni was your comfort zone. And now you're being exposed outside of your comfort zone and you didn't know how to take that. You didn't know how you would do. But look at you now, you're a PRP. So in the same respect, yeah, right now it might seem really scary to be outside of your comfort zone, but hey, in a few weeks, in a few months' time, you'll probably then feel secure and feel that you are in that comfort zone again. So yeah, change is scary. It's usually inevitable, and I think, I talk about this in a lot of my videos about perception, and I do think that the way you perceive things and changing how you see things, your outlook on things, it can make such a big difference. So yes, on one hand, it's outside your comfort zone, it's quite scary, but on the other hand, it's a new opportunity. It's a new way for you to showcase the skills that you have, whilst also expanding on your skill set too. And it's a new adventure, so embrace it. So I hope that the answers that I've given have covered your questions. If you do have any further questions, as always, please do feel free to get in touch. Facebook, Instagram, Twitter, or comment underneath this video too. And I do hope that you found this video useful. And if you did, really appreciate it if you give it a big thumbs up, share, like, subscribe. Do also visit my socials. And until next time, good luck with being a PRP. You've got this, you can do this. Be strong, have that self-belief, forget all that doubt and all those niggles and all those worries. You have got this. You've got this far. So prove it to yourself that you can go forward. You can embrace this. You can go on this new adventure and you can shine. So thank you again for watching and happy risings.